So dear colleagues, dear chairman, thank you for the invitation to give this talk. I can speak for hours about oxygen. There's a lot to say. I try to focus on the intensive care, but also about a little about the history. Atmospheric oxygen there has not been any atmospheric oxygen if you look back billions of years. But if we look to the last 500 billion years, there had been a change in the content of oxygen during that time, going from the first animal until the present day today. And the content of oxygen in the atmosphere is around 21%. If we are talking about medical oxygen, it is a drug. And I think it's the most common drug used in our society and also in the medicine. And it's also a vital part that we use every day, both in the anesthetic setting and in the intensive care. The fact is, when we look in the literature and in the daily settings, we use it very, very liberally because we are afraid of the life-threatening hypoxemia. So we have to question why and wherefore do we use oxygen as liberally as we do. Every time you use a drug or you want to know anything about a drug, you can find the summary of product characteristics. It's the SPC. There's a drug for this SPC is for every drug. And if you look on the SPC, it tells you that we can use it during anesthesia, in the intensive care unit, in the acute setting, and for resuscitation. It also shows the side effects, and the fact with oxygen is that we do not know the side effects. We know, as it's said here, it gives some soreness of the chest, it gives some dizziness, and it's a good treatment for Horton's headache. No, I swapped it. You use it in Horton's headache, but you had this soreness and you have this dizziness, and you have this eye damage, which I will show you later on. So the side effects we know is very few. It's an old drug. It was discovered in the late 17th. There was three inventors, and I will just show the one here is Joseph Priestley. He was a medical doctor, he was an author, he was a priest. He had a lot of titles, and he was very good in writing. And if I read up what he's telling us, he said when he inhaled oxygen for the first time, he tell us that it feel like my lungs was not sensible different from what was common when I inhaled common air, but I fancied that my breath felt peculiar light and easy for some times afterwards. And then he said, who can tell but that in time this pure kind of air become a fashionable article in luxury. But he also lifted his finger and gave us some warning. He said it might not be so proper for us in the usual health state of the body. For as a candle burned out too faster in this pure air, it might be said that the human body or every living animal or creature will live out too fast. After these discoveries, oxygen was used outside the hospitals, and it was put into drinking water, into food, into bread, and it was used for outpatients. And in Bristol, there was a story that it was administered to patients outside, people outside the hospital, free of charge. And it could be used for consumption, asthma, palsy, dropsy, obstinate venereal complaints, tuberculosis, and other diseases which ordinary means have failed to remove. So it was a cure-all kind of pure air that everyone was drinking or eating.